Have you ever wondered what it's really like to get healthcare in the Philippines? Whether you're planning a short vacation, thinking about retiring here, or just curious, understanding Filipino healthcare could make or break your experience. From surprisingly affordable costs to varying levels of care, what you don't know might surprise you. Is it worth the price? Should you rely on public or private care? We'll cover it all. Before we dive into the truth about Filipino healthcare and whether it's worth the cost, make sure to hit that subscribe button. Our channel, Vibrant Filipino Connections, brings you closer to the heart of Filipino life, from culture to crucial insights like this one. In today's video, we'll uncover the truth behind the Philippine healthcare system, from its affordability to its quality, and whether it's really worth it for expats and travelers like you. Stick with us as we explore what you really need to know. Healthcare in the Philippines is a topic that often sparks curiosity and concern among expats and travelers. The country has a mix of public and private healthcare systems shaped by its unique history and diverse culture. Major cities like Manila, Cebu, and Davao have some of the best hospitals in Southeast Asia, but in more remote areas, resources can be limited and wait times can be long. Public healthcare is mostly funded by PhilHealth, the National Health Insurance Program. While it's affordable for locals, it often faces overcrowding and lacks sufficient resources. For many expats and travelers, private healthcare is the preferred choice. But the real question is it worth the cost? The truth about Filipino healthcare. Whether you're an expat, a traveler, or planning to stay long-term, the answer isn't always straightforward. Let's break it down with 10 crucial points you need to consider before you make any decisions. 1. Private versus public healthcare. First, let's talk about the difference between private and public healthcare. Private hospitals in the Philippines offer a higher standard of care, but they come at a premium price. Hospitals like St. Luke's in Manila or Chonghua in Cebu are on par with Western facilities, but luxury comes at a price. A single night can cost over $500, excluding treatment. For example, my friend Alex from the US found himself at a private hospital in Makati after a routine checkup. The service was quick. The doctors were highly trained, and the whole experience felt world-class, but it came with a hefty price tag. About 3 times what he would pay back home for similar care. In contrast, public hospitals are far cheaper, but often suffer from overcrowding, longer wait times, and sometimes outdated equipment. 2. Medical costs, affordable or expensive. When we talk about affordability, it depends on what you're comparing it to. A consultation with a doctor in Manila's private hospitals can cost anywhere from 500 PHP to 1,500 PHP, $10-30 USD. That's significantly cheaper than in many Western countries. But keep in mind, additional tests, medications, and emergency treatments can add up quickly, especially if you're relying on private care. Expats can join PhilHealth for a nominal fee. For less than $50 a month, you can access subsidized care, but don't expect VIP treatment. I know a retiree from Canada shares how PhilHealth covered his surgery at a fraction of what he'd pay back home. The quality wasn't perfect, but it saved my wallet, he says. 3. Healthcare insurance. Is it necessary? Many expats and travelers opt for international health insurance when they move to the Philippines, even though it's not mandatory. Tom, a British expat who had just settled in Manila, decided to go without health insurance, thinking it wasn't necessary for a short stay. However, after a minor accident that resulted in a broken arm, he quickly realized the importance of having coverage. The cost of emergency care and the unexpected medical bills left him financially strained. Health insurance plans in the Philippines can start as low as 10,000 PHP annually, $180 USD, but the coverage may be basic, only covering general medical care. For more comprehensive plans that include things like surgery, hospitalization, and specialized treatments, you can expect to pay more. Tom's experience made him regret not purchasing a more extensive plan. If you're staying long-term in the Philippines, securing health insurance is something you should seriously consider to avoid financial troubles. For short-term travelers, not having insurance could lead to unexpected, overwhelming costs, as Tom learned the hard way. Always make sure to plan ahead for your healthcare needs. 4. Access to specialists. Specialists are accessible in the Philippines, but the waiting times can vary depending on where you are. Expats often flock to top-tier private hospitals in Manila, where you'll find internationally trained doctors in fields like cardiology, dermatology, and orthopedics. However, in smaller cities, seeing a specialist might require a longer wait, or traveling to a larger hospital, which can be inconvenient. David, an American expat living in Davao, had been struggling with a chronic knee issue for months. He decided to see an orthopedic specialist, but the nearest hospital with an expert in his condition was a few hours away. After calling ahead, he was told the earliest appointment available was in 2 weeks. David, who was used to more immediate care back home, found the wait frustrating. In contrast, when he visited a private hospital in Manila, the process was much quicker. The hospital had internationally trained specialists in cardiology, dermatology, and orthopedics, and he was able to see an orthopedic surgeon within days. However, this level of convenience came at a higher cost, something many expats in Manila are willing to pay for quality and speed of care. While large cities like Manila offer easier access to specialists, in smaller cities or rural areas, seeing a specialist may require traveling to a larger hospital, and the wait times can be longer. It's something expats should plan for, especially if they need ongoing specialized care. 5. The role of Filipino healthcare professionals. Filipino healthcare professionals are among the best in Asia, known for their exceptional skill and genuine care. Nurses and doctors here are celebrated for their bedside manner, always going the extra mile to ensure patients feel at ease. Rachel, a Canadian nurse who recently moved to Cebu, was amazed by the level of care and professionalism she experienced from Filipino medical staff, even in rural areas. What sets Filipino healthcare workers apart is their warmth and compassion, qualities that make them globally respected. Patients often feel like they're treated with genuine concern, not just as cases to be managed, but as people to be cared for. 6. Emergencies and ambulance services. When it comes to emergencies, the quality and response times of ambulance services in the Philippines can vary greatly depending on where you are. In major cities like Manila, Cebu, and Davao, ambulance services are generally decent, equipped with basic medical equipment and staffed by trained personnel. However, in more rural and remote areas, response times can be slower, and the available resources may not be as robust. Take the story of John, an expat from the UK who had lived in Cebu for a couple of years. One day, while hiking in the hills outside the city, he slipped and severely twisted his ankle. His immediate thought was to call an ambulance, but soon realized that the nearest hospital was a good 45 minutes away. Luckily, he was able to get help from a local who drove him to the nearest clinic. However, the experience highlighted a crucial point. Always be aware of where the nearest hospital or clinic is when you're traveling in the Philippines, especially if you're heading out to more remote or rural areas. Staying informed and planning ahead can make all the difference in an emergency. Pharmacies and over-the-counter medications. One of the benefits of living or traveling in the Philippines is the easy access to pharmacies and the affordability of over-the-counter medications. Pharmacies are everywhere, often open late, and provide a wide range of common medications without requiring a prescription. The best part? They're usually much cheaper than what you'd pay abroad. Take Lena, an Australian traveler who needed allergy medication while in the Philippines. She was amazed to find the same medicine at a local pharmacy for a fraction of the price she would pay back home. Lena also stocked up on pain relievers and cold meds, saving a lot in the process. Many pharmacists in the Philippines are also eager to help, offering advice on treatments and alternatives for common health issues. While most medications are affordable and easily available, some stronger prescriptions may still require a doctor's approval. 8. Healthcare access. In rural areas, healthcare access can be more limited. While major cities like Manila have advanced hospitals, clinics in provinces often lack the same resources and modern facilities. If you live in less urbanized areas, you might need to travel to a larger city for specialized care or rely on basic healthcare services. Take John, an expat who moved to a small village in the province. When he developed a sudden fever, he had to visit the local clinic, which had basic equipment and no specialist available. He quickly realized that for more serious issues, he would need to travel to the nearest city for proper care. 9. Language barriers. Although English is commonly spoken in hospitals, especially in urban centers, you may face language barriers in more remote locations. Many healthcare workers in rural areas speak only Filipino or local dialects. Maria, an expat from the UK, had a tough time when she needed to see a doctor in a rural province. The medical staff spoke only Filipino and the local dialect, and Maria didn't speak either fluently. Luckily, her local friend stepped in as a translator, but not everyone may have that option. If you're traveling or living in remote areas, it's helpful to have someone who speaks Filipino or a translator with you to ensure clear communication with healthcare providers. 10. The healthcare system for expats. Are you covered? As an expat, you're not automatically covered by PhilHealth, the National Health Insurance Program. However, private health insurance options are available, and it's essential to get comprehensive coverage to avoid unexpected medical expenses. Make sure to do your research and choose a plan that meets your healthcare needs while in the Philippines. Sarah, an American expat, learned this lesson the hard way. After an accident, she found herself with large medical bills because she didn't have private health insurance. Unlike locals, expats need to secure private health coverage to ensure they're fully protected. Afterward, Sarah researched different plans and found one that offered comprehensive care for a reasonable price. This experience taught her how important it is to get the right insurance to avoid unexpected medical costs. So, is Filipino healthcare worth the cost? It depends on your needs and where you're located. While healthcare in the Philippines can be affordable and accessible, the experience can vary depending on whether you're choosing private or public services. If you're planning to stay long-term or require specialized care, it's best to budget accordingly and consider insurance options. The Philippines offers a great healthcare system, but being prepared and informed will help you navigate it smoothly. To sum up, healthcare in the Philippines offers both affordable options and higher-end, costly services. It's important to weigh your options based on where you live, your health needs, and your budget.
Don't forget to subscribe, like, and leave a comment with your thoughts. And of course, let us know what topic you'd love us to cover next.